Aphorism 291. Baths of pure water prove themselves partly palliative, partly as homeopathic, serviceable aids in restoring health in acute diseases as well as in convalescence of cured chronic patients with proper consideration of the conditions of the convalescent and temperature of the bath, its duration and repetition. But even if well applied, they bring only physically beneficial changes in the sick body. In themselves, they are no true medicine. The lukewarm baths at 25 to 27 degree serves to arouse the slumbering sensibility of fiber in the apparent dead, frozen, drowned, suffocated, which benumb the sensation of the nerves through only palliative. Still, they often prove themselves sufficiently active, especially when given in conjunction with coffee and rubbing with the hands. They may give homeopathic aid in cases where the irritability is very unevenly distributed and accumulated too unevenly in some organs, as is the case in certain hysterical spasms and infantile convulsions. In the same way, cold baths 10 to 6 degree in persons cured medically of chronic diseases and with deficiency of vital heat act as an homeopathic aid by instantaneous and later with repeated immersions. They act as a palliative restorative of the tone of the exhausted fiber. For this purpose, such baths are to be used for more than momentary duration, rather for minutes and of gradually lower temperature. They are a palliative which, since it acts only physically, has no connection with the disadvantage of a reverse action to be feared afterwards, as taken place with dynamic medicinal palliatives. Explanation. In this aphorism, Dr. Hahnemann has given idea about bath. Baths of pure water prove themselves partly palliative, partly as homeopathic serviceable aids in restoring health in acute diseases as well as in convalescence of cured patients. But there should be proper consideration of the patient who is in convalescence period, temperature of bath, duration of bath, repetition of bath. But even we apply bath with these measures, they may bring only physically beneficial changes in the sick body. Baths are not true medicine. The lukewarm baths at 25 to 27 degree serve to arouse inactive or less sensibility of nerve fiber in the apparently dead fibers with their benumb sensations. Though baths are palliative, still they often prove themselves sufficiently active when given along with coffee and rubbing with hands. Baths may give homeopathic aid in cases where the irritability is unevenly distributed and also accumulated unevenly in some organs, for example, in case of hysterical spasms and infantile convulsions. In some way, cold baths at 10 to 6 degree in persons who are cured medically of chronic diseases and with deficiency of vital heat act as a homeopathic aid with repeated immersions. The baths act as a palliative restorative of the tone of the exhausted fiber instantly and later also. For this purpose, such baths are given for very short period, momentary, rather for minutes, generally given of low temperature. Such baths are palliative because it acts only physically and it has no connection with the disadvantage of the reverse action to be worried of. As such, reverse action take place with palliation by dynamic medicines. Baths are proved as homeopathic serviceable aid means baths may act as homeopathic aid. For example, mineral baths may have their remedy accidentally.